Hello guys, welcome to our channel, The Surgery Times. Myself, Dr. Aditya Prasad Padi. Follow us in Instagram, Telegram, YouTube and Facebook and join us for daily quizzes at 10 p.m. in Telegram. Also follow me in Concept Group faculty. Now the mock tests are free of cost, so please utilize this. Today's topic is one page TNM of whole GIT. We will study about esophagus, stomach and colorectal carcinoma. Very important topic. And nowadays one clinical questions you can face like 60-year male with history of partial gastrectomy came to your SOPD with a histopathology report showing tumor infiltrating through the mucosa or submucosa with 5 to 6 lymph node involvement. So what is the TNM staging for this case, or how will you follow or further management for this case? So like this the questions are coming, so it is very important. In one page only we will remember the comparatively. So please see the video 2 to 3 times. So prior to TNM classification, I will say briefly about the histology of the gut. Okay, this side is the lumen, and here first layer is lamina propria, then followed by muscularis mucosa, submucosa, muscle, then subserosa, then serosa. Okay, subserosa is not mentioned here, remember this. So in the muscular layer there are 4 layers again. Here it consists of, okay, first is muscular coat, then muscular fibers, okay, muscularis propria, then muscularis externa. And just remember this because it will helpful in the remembering TNM classification. And in depth knowledge regarding the histopathology you will get in the histology. Okay, so if the tumor is involvement up to here, this large tumor is there, okay, up to the muscle or muscularis propria, then it will come under T2. Up to here it will come as T1. Okay, just briefly I am telling to remember like this easily, and we will discuss in detail in our next slide. Here already there are 3 pictures put of histopathology. One is esophagus, one is stomach, one is colorectal carcinoma. Very important. Okay, so you can see T1, T2, T3, T4 I have written in a comparative way. The sky blue colors are nothing but it is A, B subdivision, that is B. Okay, it is B. Blue means B. T1A, T1B. So up to here you can see this is just 1 minute. Submucosa is here. Okay, then muscularis propria is inside this. So here also submucosa and here also submucosa. So remember like this. Up to this submucosa is T1 and after that T2. Then after that T3 and T4 usually adjacent structures. Easy. So T1 is involvement of lamina propria and mucosa and submucosa. Out of them T1A is lamina propria and mucosa only, and the same way full esophagus, stomach and colorectal described. And T2 is always muscularis propria, muscularis propria, muscularis propria. Now comes to T3 and T4. T3 is beyond muscularis propria, that is involvement of adventitial layer. Adventitia means because here there is no peritoneum, so no serosal layer. In case of esophagus, it is adventitial layer that is made of connective tissue. Now T4 is outside, that is adjacent structure is always T4. And again it divided into A and B. A means involvement of peritoneum, pericardium and pleura, then azygos vein and diaphragm, whereas T4B is involvement of airway, vertebra, aorta. Okay, these are tubular structure. So remember this. Now next is stomach. Stomach T1, T2 is same way. You can see in a comparative way, whereas T3, T4 is different. So T3 is subserosa and serosa. Okay, so T3 mainly involvement of subserosa as well as visceral peritoneum. Okay, and T4 is serosa and AS means adjacent structure, you know already, as it is written in blue. T4A is involvement of serosa, T4B is involvement of adjacent structure. Now come to the colorectal carcinoma. The same way T1 is MSN, T2 is MP always. Okay, MP. This one is always T2. This one is T1. Okay. Now T3 is pericolorectal tissue. T4 is again divided into T4A and T4B. So esophagus has no T4AB. Sorry, esophagus has T4AB, and stomach has also T4AB, and colorectal also have T4AB. Okay, remember this. And T1AB is no, colorectal don't have, rest all have T1AB. Okay, don't confuse over here. And BP is again visceral peritoneum, and AS is adjacent structure. So let me memorize you. Okay, just go on seeing this. LP, MSM, MSM, because no lamina propria here. Okay, and next is always muscularis propria is T2. T3 is adventitia, connective tissue layer. Here subserosa and visceral peritoneum. Here pericolorectal tissue. Whereas again AB, okay, PPP, ABD means peritoneum, pleura, pericardium, esophagus vein, diaphragm, aorta, vertebra, and next is airway. Now here in stomach it is again T4A, B, serosa and adjacent structure, visceral peritoneum and adjacent structures. Remember, now after T, next is N, nodal, then M. So M is M0, M1, no need to worry, no metastasis is present. So N is again you can see 1 to 2, 3 to 6, more than 7, same. 1 to 2, 3 to 6, more than 7, but it again divided into 7 to 15, more than equal to 15, 16. Remember, now colorectal carcinoma is also some extent to same, but here 1 to 3 and more than 4. Again divided into N1A. N1A means 1 lymph node involvement, N1B is 2 to 3 involvement, and N1C is no lymph node involvement, but subserosal lymph node or mesenteric lymph node or pericolic or perirectal lymph node involvement, whereas N2A is 4 to 6 lymph node, whereas N2B is more than equal to 7 lymph node. So remember this full chart, keep in front of your eye so that it will be easier. Okay, so this one is a chart, and this is how we are completing the TNM in easier way. Share with your friends, like, share and comment, and follow us in Instagram, Telegram, YouTube as well as Facebook, and also put in the comment box about your next topic you want to memorize or whichever you are facing difficulties. So see you in the next topic. Till then, bye.